Top 15 Best Food for Diabetes Control. Chia seeds. Some preliminary research indicates that chia seeds could help people with diabetes control their blood sugar and protect their hearts. Studies in animals show that a chia-rich diet lowers harmful LDL cholesterol and triglycerides while increasing beneficial HDL cholesterol. And a white-seeded variant of chia called Salba helped diabetic volunteers control their blood sugar, as well as their blood pressure and new markers of cardiac risk, such as C-reactive protein. The results were published in the journal Diabetes Care. Unsweetened Greek yogurt. Studies have shown a 14% lower risk of type 2 diabetes with daily yogurt consumption. With a low GI score, unsweetened Greek yogurt is full of healthy probiotics, calcium, and protein. It's also a better option than regular yogurt due to its higher protein and lower carbohydrate content. Kale. Kale is the king of super healthy greens. It provides more than 100% of the recommended daily intake of vitamin A and K. Kale contains chemicals called glucosinolates that help neutralize cancer-causing substances. It's also full of potassium and has been shown to help manage blood pressure. This is another reason it's considered a superfood for those with diabetes. Eggs are a versatile food and a great source of protein. The American Diabetes Association considers eggs an excellent choice for people with diabetes. That's primarily because one large egg contains about half a gram of carbohydrates, so it's thought that they aren't going to raise your blood sugar. Beans. Beans are among nature's most nutritious foods. They're high in fiber and protein, making them a great option for vegetarians and vegans. They also deliver essential minerals like magnesium and potassium. They are low on the GI too. Soya beans rank in around 16, while kidney beans come in at 24 and chickpeas around 28. According to a study in 2012, beans may be a good way to control glycemic levels in people with type 2 diabetes. They can also reduce the risk of coronary heart disease. Avocado. Avocados are low in carbohydrates, which means they have little effect on blood sugar levels. A recent study published in Nutrition Journal evaluated the effects of adding half an avocado to the standard lunch of healthy, overweight people. They discovered that avocados do not significantly impact blood sugar levels. Part of what makes avocados a good choice for people with diabetes is that although they are low in carbs, they are high in fiber. Many other high-fiber foods may still spike blood sugar levels. Lentils. The soluble fiber in lentils helps stabilize blood sugar levels. If you have insulin resistance, hypoglycemia, or diabetes, lentils are full of complex carbohydrates that can help you. They can control your blood glucose levels, control your cholesterol levels, control your appetite, and lower your risk of getting type 2 diabetes. Apples. If you have diabetes, keeping tabs on your carbohydrate intake is important. That's because of the 3 macronutrients: carbs, fat, and protein. Carbs affect your blood sugar levels the most. That being said, not all carbs are created equal. A medium apple contains 25 grams of carbs, but 4.4 of those are fiber. Fiber slows down the digestion and absorption of carbs, causing them to not spike your blood sugar levels nearly as quickly. Studies show that fiber is protective against type 2 diabetes and that many types of fiber can improve blood sugar control. Nuts. Nuts are a healthy addition to a diabetic diet. They are low in digestible carbs and help reduce blood sugar, insulin, and LDL levels. Garlic. A new study has found that consuming garlic could help reduce levels of blood sugar in people suffering from type 2 diabetes, as well as offering other benefits in the treatment of the metabolic condition. Although the research recommends using garlic for reducing blood sugar levels only under the guidance of your doctor, it could provide a range of benefits for diabetics in conjunction with their usual treatments of insulin and diet. Broccoli. Scientists gave sulforaphane to obese patients in the form of a concentrated broccoli sprout extract. They found that it improved the patient's system's ability to control their glucose levels and reduce their glucose production. A compound found in cocoa, the main ingredient in chocolate, may help prevent and treat type 2 diabetes. Researchers at Brigham Young University in Provo, Utah, discovered that the substance known as epicatechin monomers helps the body release more insulin and respond more efficiently to increased blood glucose. Fatty fish. Fatty fish is one of the healthiest foods on the planet. Salmon, sardines, herring, anchovies, and mackerel are great sources of the omega-3 fatty acids DHA and EPA, which have major benefits for heart health. Getting enough of these fats on a regular basis is especially important for diabetics who have an increased risk of heart disease and stroke. Cherries. Cherries may one day be a part of diabetes treatment. The sweet and tart versions of the fruit contain chemicals that boost insulin, which helps control blood sugar levels. The chemicals are called anthocyanins. They occur naturally in cherries, giving them their bright red color. Anthocyanins also tint other fruits, vegetables, and flowers with bright reds, blues, and purples. Fruit containing the chemicals has shown promise in reducing heart disease risk. Berries. The glycemic index is a scale on which carbohydrate-containing foods are ranked. Foods that have a high score quickly raise blood sugar, while foods with low scores only gradually raise blood sugar. Low-ranking foods score below 55. Fresh strawberries, blueberries, blackberries, and raspberries all have scores below 40. If you have diabetes, the key to maintaining your blood sugar is to use portion control. Thanks to the low carbohydrate density of strawberries, you can safely enjoy 1/4 of a cup of a serving. For blueberries, it's 3/4 of a cup. For blackberries, 3/4 of a cup. And for raspberries, it is 1 cup.